stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Happy Thursday, everyone. Welcome to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health agency operating in Dade, Broward, and Palm Beach County. You can reach out to them for all of your home health needs at 954-717-7027 or info@allcountyhealthcare.com. I'm your host, Dawn Graubert, and I am excited to bring you Dr. Jennifer Stone this evening. She has her doctorate in nursing practice, an MBA, an APRN, an FMPBC, and MSCP. Incredibly highly qualified, lovely conversation we're going to have. She is with Stone Healthcare. It is a telemedicine practice. Their website is www.mystonehealthcare.com. Dr. Jennifer Stone is a board-certified family nurse practitioner with a Doctor of Nursing Practice degree. She has advanced clinical training and more than 24 years of experience in primary care, hormone optimization, and weight management. As a certified menopause specialist and obesity management specialist, Dr. Stone blends evidence-based practice with a personalized, compassionate approach. She's dedicated to helping individuals navigate the complexities of hormonal health, metabolic challenges, and overall wellness. Through tailored treatment plans and ongoing support, Dr. Stone empowers her patients to achieve sustainable results and feel the best at every stage of life. Her practice offers a welcoming, supportive environment where your unique needs and goals guide every step of your health journey. Her number is 954-807-3486. And for all of you listening, she can work within the areas of Florida, Arizona, Colorado, and Minnesota, all through telehealth. So let's welcome Dr. Stone. Happy Thursday. Thank you so much for joining us.
Thank you so much for having me.
It is such a pleasure. Welcome to You and Your Doctor. Can you tell everyone a little bit about what put you in the field that you're in, Doctor of Nursing Practice?
Yes, sure. So I RN from the get-go, right out of high school. I went to nursing school, became a registered nurse, and worked for quite a few years, probably about 12 years in the hospital, working in cardiovascular intensive care, and really just felt that I wanted to focus a little more on prevention. So before they came to me in the hospital. And so I went back to school and I became a family nurse practitioner. I originally got my master's first, and then later on had gone back and received my Doctor of Nursing Practice. But, I really went for the family nurse practitioner so I could have more impact across the lifespan, and I could work more on prevention before they get to the hospital, so out in the community. And that's really been my passion ever since, has been preventative care.
And tell me about telehealth versus seeing someone in person, hand to hand.
Sure. So for many years, up until about 2 years ago, I did see patients in person, and and there's benefits to both. With telehealth, I'm able to provide more of flexible schedule for patients. They're able to see me in the convenience of their own home. So, these are for patients who also may live in rural areas, so they don't have means and transportation to get to a doctor's office. Or some of them that are embarrassed by certain conditions they may have, or not want to talk, or sit in a waiting room, decrease wait times for sure. I do provide when you do it telehealth, you provide more of a one-on-one personalized approach. So it's the patient and myself on a HIPAA compliant privacy platform, really discussing the goals and any symptoms the patient may have, and coming up with a individualized plan for the patient to achieve, their own goals. And it's a relaxing environment. I do feel that I can spend more time with them. You're not rushed with, moving one patient in the door and out the door. So I'm really able to open my schedule and make it as short or long as a patient needs to have that visit. So it's not that this has to be a 15-minute visit with my patients. I might need to see you for that full 30 minutes or even 45 minutes, so we can really break down what your healthcare goals are and give you the best plan to achieve those goals.
It's really interesting. Things I hadn't thought about. Maybe the patient didn't want to sit in an office with other people, right? Maybe they've got a skin condition or their weight, whatever it is in their mindset that they feel embarrassed by. They don't want to be with other people. This gives them the privacy to do it from their home or office and really just have a one-on-one conversation with you.
Right. And I do feel I have noticed, what I have seen is patients are more open with their conditions. So they communicate more with me than they had in the office, which I found was interesting. Even some patients that followed me from my office to the telehealth platform are opening up a lot more, especially in the area of obesity. Some obese individuals, they're embarrassed to go to an office. Sometimes in the waiting rooms, maybe they don't fit in the chair. If it's not what we call a weight conscious practice, maybe they don't fit in that waiting room chair, or they don't want to stand on the scale in front of people walking down the hall, or, it can be very embarrassing. So when me being able to see them telehealth and virtual, I think it brings them more comfort to be open to even seeking care for their weight.
Things that you don't even really think about. And you've seen the difference. Did you realize when you switched platforms what would change, or have you even learned more as you go through the process?
Definitely learning as I go through the process. And I did expect there to be some hiccups, which there are, because sometimes patients do need to be seen in person. And I'm able to really, when I get on that call with the patient and talk with the patient, I'm really able to triage that. Most of the patients are able to be seen. Most primary care conditions can be seen telehealth, menopause treatments, andropause for men, any of the weight, those can all really be done telehealth. But if I do get on a call and I feel, you're not sounding good, your cough is sounding pretty bad, or, you sound really short of breath trying to speak to me, I would refer them either to urgent care, or I do have colleagues in the areas of Broward and Palm Beach County that I can refer them to as well. That would give them that in-house visit. So it is good to still have that connection in the community. Menopause treatment, I still have that connection with gynecologists, so they have their pelvic exams. I am able to prescribe any imaging, and I can, that comes to me via telehealth as well, so I can review all of the imaging, any medications, any blood work, all of that I can do very easily via telehealth.
And you work with weight management, primary care, hormone maintenance and replacement. But before we get into that, people are thinking, all right, you're a doctor of nursing practice, Dr. Jennifer Stone, a DNP. What different in your training versus a physician? Now, we know different schooling, you're nurse, and then there's medical school. But why do you think patients may feel more comfortable seeing you than a classic MD or DO?
Well, and I mean, I have plenty of colleagues that I collaborate with that are MDs and DOs and physician assistants as well, and the PAs. As far as the difference in schooling, in order to enter a nurse practitioner program, you have to already be a registered nurse with a bachelor's degree, right? So we have that background where we've been working with patients for quite a few years prior to even entering nurse practitioner school. And then during nurse practitioner school, I think a big difference between the nurse practitioner nursing studies versus physician studies, besides all the residency, is we look at more of a holistic lens with nurses. We include families into our plan of care. So we don't just say, okay, this patient's coming in and, they might have diabetes. So we look at underlying cause of diabetes. We look at family dynamics that may be impacting diabetes, social determinants of health in their community, finances, things of that nature. So I think we look at it more from a holistic lens opposed to diagnose, treat, and the science behind it. Not that we don't look at the science behind it, but I think we add a little bit more complexity to it. And then when you move on and you get that Doctor of Nursing Practice degree, you look at issues in your community, concerns, healthcare concerns in your community, and what you can do to impact that community. So, diabetes, for instance, we might look at in underserved communities. Is diabetes worse in those communities because of lack of food resources, of healthy food resources and healthy food choices? So when you have a Doctor of Nursing Practice, you implement programs to see how those would help improve patient outcomes in those communities. So it is a little bit different from that aspect than going to residencies in med school.
It seems broader, and I think those that go into nursing versus traditional medical school, it's a different mindset, it's a different type of personality, because to go into nursing, you're looking at different things from the get-go.
Yes.
Right? You're looking at overall patient care, you're looking at family outcomes, community, what's impacting people as a whole, which is a whole different perspective.
Right. It really is. We look at it from a holistic lens, and I think that is why so many nurse practitioners spend more time with patients and they listen to patients. Sometimes I feel like I wear a dual hat. I have patients who just want to talk to me like I'm a therapist. Now, I'm not a therapist and I do not pretend to be one, but I am a nurse and we do listen very well. And we have we know the resources, where to send our patients if we need to, but we do wear multiple hats.
But I feel you're very easy to talk to. I've known you for quite a long time, and I just reached back out and I wanted to connect and see what's happening with practice. And I can understand why a patient would feel so comfortable having a telemed visit with you. It's just like this conversation we're having here, and as a woman, it's easy to talk to you because it's like having a good friend who understands right here in your own house or your own bedroom, wherever you're having the conversation. And I could see why it would lend people more to opening up with you, to say, this is what's happening, my hormones are a little off, instead of feeling that everybody's judging them in an office.
Absolutely. Absolutely. And I have many patients who I treat, the husband and the wife. I started with one or the other. And because I made one or the other feel so much better, like I've had husbands come in and say, I don't know what you did to my wife, but you saved my marriage and you gave me my wife back. And then the wife says, yeah, give him some too. Give him some of those hormones as well. So, I love when I hear that, you saved my marriage, or, I'm no longer suffering. I can sleep now. My work is improved. It makes such a difference. And that's what I do that for. That's what I do this for. I think that's what all nurses do that for, is to see that improvement in their patients at any level.
All right, we're going to take a quick commercial break. When we come back, we're going to get in the nitty-gritty of the people you can help and all the ideas and all the different modalities that Dr. Stone works with weight loss, with hormone therapy, and overall general primary care. More to come from All County Healthcare, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. You can reach All County at 954-717-7027. I'm here tonight with Dr. Jennifer Stone, a doctor of nursing practice of Stone Healthcare. Her direct number is 954-807-3486. All right, let's get back into the conversation and talk about the things and the people, symptoms, illness, symptoms that you work with. Let's start with weight loss. Big hot topic right now, right? Semaglutide and all the other things people are working with. What are what are you working with? Different ways for weight loss.
So different ways for weight loss. I have a comprehensive weight loss plan, and the plans are individualized. What works for your neighbor is not necessarily going to work for you, right? So it's very important to not cookie cut it. So I do a comprehensive in a telehealth visit with the patients, find out the medical history, what is your current weight, what are your goals, right? You don't necessarily have to be skinny as anything to be healthy. Sometimes skinny people are not healthy, right? So we want to look at how we can be healthier, not necessarily skinnier. So with my weight loss program, we always start off with lifestyle recommendations. We go on a nutrition plan, protein. We talk a lot about protein. Protein is very important when you're on a weight loss program. Protein is also very important if you're going to go on any of those GLP-1 medications, such as semaglutide, tirzepatide. And not everybody's a candidate for those medications. So it is important. I know there's a lot of websites out there where you can just go on, click a few buttons, and they ship you the medication. I do not recommend that. I firmly believe that you should be getting your weight loss management plan, medications, whatever it is that you need, supplements. It should be prescribed to you, and the plan should be developed by somebody who is knowledgeable in obesity management.
Why would someone be okay with it, and why would it not work for others? Are there different comorbidities, different disease states, health issues that would say this is not for you?
Yeah, sure. So as far as the GLP-1 medications, your semaglutide, tirzepatide, and all of those that go in that category, the most contraindications would be somebody who has a personal or a family history of a certain type of thyroid cancer known as medullary thyroid cancer. Also a certain type of very rare, but it is an inherited genetic condition known as a multiple endocrine neoplasia 2, which basically means multiple tumors throughout endocrine glands. They would not be a candidate for those medications. Anyone with active gallbladder disease, because it can impact the gallbladder, so I would recommend having your gallbladder removed if you do have active disease. Anybody with acute history of pancreatitis or current pancreatitis, because it does work on the pancreas as well. That's where our insulin comes from, so it does work there. And then anybody who's allergic to the medication, would be contraindicated. And type 1 diabetics would be contraindicated. Type 2 diabetics do take these medications, but type 1s do not take these type of medications because they don't even produce insulin. So anybody who fits into that category would not be a candidate for the medications. Not to say there aren't other options there for them, because there are multiple other different classifications of weight loss medications that they can take, as well as just supplements and your lifestyle, your physical activity routine, your nutrition routine. So there are other components that weigh in there, and not everybody necessarily has to be on prescription medication.
And I think this might be a good segue into hormone therapy, because sometimes weight management is tied to low hormones, right? Low testosterone, low estrogen as we enter menopause, andropause, aging. So this is where you come in and you have this conversation and say, well, let's look at your hormones. Do you order labs to look at the hormones, or you pretty much say you're over 55, you need X?
I don't, some labs, we do order some labs. I do not really look at estrogen levels in women, especially if you're in perimenopause. And there is a myth that goes, you do not have to stop having a period in order to start hormone replacement therapy. So if you go to somebody who is not well versed in menopause management and hormone replacement therapy, that person may say to you, oh, you have to wait until you stop having your period. It doesn't matter that you have hot flashes and night sweats and mood swings. That is not true. Research actually shows the earlier in perimenopause, even late 30s, early 40s, that you start this hormone replacement therapy, the more protective it's going to be for you from cardiovascular disease. It's going to protect your bones and protect cognition. It's important to really understand who your patient is and what your patient needs, right? So when I have patients who come in and they're just talking about, I want to lose weight, that's great. You want to lose weight, but let's also look at what are your hormones doing? And not just your sex hormones, female sex hormones, estrogen, progesterone, testosterone, but what is your thyroid doing? Those hormones have a big impact on weight as well as an impact on the other hormones in your body. The thyroid is the engine that drives your body. It is your engine. So if your thyroid is off, your weight will be off and your hormones will be off as far as your estrogen, testosterone, and so forth. So it is a very nice dynamic, and you can't just pull one out and treat that. You have to treat it all. You have to treat everything as a whole, especially with hormones. Hormones talk to each other and they work with each other. And when one is off, it's like a domino effect. So you have to have a nice balance amongst all of them.
And I feel like this is a big evolution in healthcare, because I remember when I was diagnosed with thyroid disease in my late 30s, early 40s, perimenopause was not anywhere on the table. So it was going to the endocrinologist and looking at symptoms, symptoms were there, labs were not. So I suffered for years, and finally the endocrinologist said, okay, let's look at this. But the GYN, there was never a segue or an overlap of let's look at everything. And right. Even now, I finally have someone that sees everything like you do, an overall practitioner. But many people don't realize that even exists. So they go from their primary to the GYN to the endocrinologist, or for men, right, the urologist, and they're trying to balance everything. And that's where I think what you offer is I want to say unique, but it really should be the standard of care.
Right. And just as you said with that, there's your gaps. That is your gap in care. And we need to bridge those gaps. And I feel that, the services I provide bridge most of those gaps. And I do have colleagues in the community that I work with then to help bridge the rest of the gaps, right? But when you do go to one doctor who might not be aware you went to the other doctor, who might not be aware you went to the other doctor, and then you're not getting that continuity of care. And that is so important and again, that goes back to the nursing and that holistic treatment that you have.
You can totally
but you have to look at the whole picture. You have to look at the underlying cause. What are your symptoms? I'm not going to say to you, okay, Dawn, your estrogen's this level, so you need to be on this type of estrogen patch or this dose. No, I want to say you're having hot flashes and mood swings and night sweats. Let's start you on estrogen. We're going to see you back in a month and see how you feel. It's not about see you back in a month and check your estrogen again. We want to see you back in a month and see how are your symptoms. And that's what we go by, because my number might be the same as your number, but I have no symptoms and you have plenty. It is very personalized when it comes to hormone therapy, weight loss. It's very individualized.
And for men as well, we're looking at testosterone. I did not realize until you told me testosterone is prescription-based, is a controlled substance.
It is a controlled substance. So not everybody can provide it. You do have to have a DEA registration to be able to prescribe testosterone. But testosterone is so important for men and women. Women need testosterone just as much as a man does. It does help protect your bones. There are studies that show it helps with decline in prevent decline in cognition. So it does have some Alzheimer protection, bone protection, cardiovascular disease protection, both in men and women. So important for both.
So hormone replacement is more than just for sex, for sex drive, for intimacy. Hormone replacement is really what's guiding your entire body, from thyroid to estrogen replacement to even testosterone for men. Alzheimer's, you said, brain fog, organ
Prevention of
functioning properly.
osteoporosis.
So many things that people didn't realize because of all the black box warning, I guess, that came out so many years ago. And
Yes,
I feel
the
like
black
what a
box
disservice
warning-
it did to so many people.
Oh, that the Women's Health Initiative study, which was results were released in the summer of 2002, really put a lot of fear into the community and providers and patients, put a lot of fear into both, because first of all, it was the participants in the study were about in their 60s, so they were about 10 years postmenopausal, and we do know the earlier you start the hormones, the more protected it is. So they were already 10 years postmenopausal, and they were taking in the certain arm of the study, the estrogen and progestin portion of it. They were taking a medication called Prempro, which has a certain type of progesterone that we do not prescribe anymore, which is medroxyprogesterone acetate, MPA. And we don't prescribe that anymore. But in that study, they had an increased risk. They had an increased incidence of breast cancer, and it was about 25%, which seems really scary, but that was about 4 out of 5,000 over a 5-year period. And the women who had the estrogen alone actually did phenomenal in that study. And we don't use that progesterone today.
We're already running out of time, Dr. Stone. I can't even believe that it went so fast. We have to bring you back. We have to bring you back into the studio and to touch base on everything else that you're working on. What is the best way for people to contact you? This information is so incredibly amazing and compelling.
Absolutely. My phone number is 954-807-3486. My website also has a direct link into booking appointments with me, which is www.mystonehealthcare.com.
It is such a pleasure. I can't believe this half hour went so fast. There's so much more we're going to tap into on the next time. But contact Dr. Stone, her holistic approach, her overall approach to weight loss and hormones and primary care. Fabulous. Thank you for your time.
Thank you so mumuch for having me.
I appreciate it. And thank you for joining us tonight on You and Your Doctor, sponsored by All County Healthcare. Again, you can reach All County at 954-717-7027. And to find Dr. Stone directly, you can reach her at mystonehealthcare.com. Have a great evening, everyone. Stay safe, and I'll see you next week.